Good evening, everyone. With the posted time having arrived and a quorum of members present, I'll call the Public Health and Safety Committee for Monday, October 22nd, 2024 to order. The first item of business is to approve the minutes of our previous meeting from 9/16, copies of which were in the packets. Did anyone note any adjustments to the minutes they needed to see? If not, I'll take a motion to approve the minutes. Motion from Watson. Is there a second? Second from Lukens. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye. Opposed? None are opposed. That item carries. Item number 2 is discussion and possible action on approval of the third amendment to the American Rescue Plan Act Catholic Charities Subrecipient Agreement. You have some information in your packets, including a memo from Tammy about the current state of the Catholic Charities Night Center and Day Center funding that we're using ARPA for. And so we'll bring Tammy up because she has another place that she needs to be by 5:30. So we'll have her kind of walk us through what you're seeing and why. You know, we have to commit the rest of the ARPA funding by year end. So time is winding down. And so now they're trying to ascertain the unspent funds to figure out if they have too much, have enough, and get that all allocated before year end. So welcome, Tammy.
Thank you. I know a lot of you know the history that's going on here. We had brought a proposed third amendment to Finance Committee earlier this month, requesting that we just extend the subrecipient agreement because there's funding left over, actually quite a bit of funding left over, until it was completed, which could go, we think it would be done by the end of next year, 2025. However, there's concerns, and Alder McElhaney asked us to do some checking, which we did. And in your packet, there's the most recent quarterly report. We were getting them timely. We had to, push them a little bit. And in the quarterly report, it talked about the partnerships that the Day Center works with out there. So Shannon reached out to all of them, and you got the responses in there. So you can take it for what it's worth. Interesting part is we did get an email from Catholic Charities late Sunday night. So I don't know if they saw the packet, but they talked about other issues that, yes, they're having problems with the Day Center. They lost several key people. They just hired someone, but it's more for the overall housing director. I can't remember the exact name. They have someone that's been filling in for the Day Center. However, it's one person. And activities, it pretty much is giving them a place to be.
Right.
So we talked things over amongst ourselves and thought maybe to meet you halfway, we would say, let's just extend this through the Day Center services through April 31st since the winter's coming. And as of November 1st, we no longer pay for the warming center.
Right.
ARPA
They
funds
fund
just-
the winter.
Correct,
Yes.
correct. So we would just have to extend the day services through April. And when you look at the invoices, the winter months are the ones that are costing us the most. They're like anywhere between $20,000 to $30,000 a month, where the Day Center is about $4,000 to $8,000. They're somewhere around there. So it's a lot more inexpensive. So in this agreement, we calculated out what we anticipate the ARPA funds would fund if we go through April 31st, if you decide that that's what you want to do. And that would leave about just over $300,000 of ARPA funds that would go back to the pot, which obviously we have to take this to finance and then council. But then you can decide what you want to do with that extra money.
Sure. I think that's a reasonable approach. When we first set out down the path of a day center and a night center, year-round night center, the one thing that we were expecting was, first, the day center idea, I think everyone remembers, sprung out of the fact that there was an awful lot of pressure on other public infrastructure and facilities when the mall left us, which was a heated indoor area where people could be, that they could no longer be. And so in response to some of that, we started talking about a day center. But I think that our vision as a unit of government funding the day center was that would come with some measurable metrics for first off, how many people got assisted and how, and it would also come with some measurement metrics and some deliverables for service to those who are partaking of the day center. So if they are offering, certain services one day a week, or they're offering consultations or interactions with other agencies to get people on a path from, point A to point B, that we would be able to measure the impact both in terms of service numbers and in terms of people who are either remaining in that situation or exiting that situation for a better position. So, I think that sometimes that's been difficult to quantify. We have received numbers from them on a monthly basis, through our outreach coordinator as far as who's all getting served in terms of raw numbers. But, I think our original vision was that we would be able to measure certain performance factors that we're not really able to measure right now. So I think one important thing for us to do with the provider of the day center and the night center for that matter is to make sure everyone's on the same page and that everyone's expectations are going in the same direction, that they understand what we expect from them and what we'd like to see in terms of results in exchange for the dollars, and that we understand what their intentions are in providing the service and what struggles or successes they've had. And so I think if we have those discussions over these winter months, we'll continue that funding, like you said, until the end of April, then I think we could come forward with an agreement that is easier to measure, and it's, I think, easier for us to demonstrate as a funder where those dollars made that impact. I think that really makes some sense. So, there's been a lot of ARPA asks. There's been a lot of things that the Finance Committee, even in the last term, kind of put a pin in to see where they end up at the end of the ARPA cycle. And the one thing we don't want to do is return revenue back to the federal government. So we want to do the most work in the community that we can do with those dollars. And so, I think continuing the initiative we started, which our original goal was to stand it up for 2 years, we're there. And then figure out what that path forward looks like together, because we really are working in partnership with them. And I think both partners need to have clear expectations, or maybe clearer expectations. And I think you found that as you've been trying to audit the financials back and forth, with all of this, it was a new venture. It was new for us. We've not ever done that before. We've ended up with 2 different providers because we struggled with the first one, and the second one, offered those services, obviously. But I do think that, this is a sensible approach. We've been asking for different deliverables and more deliverables, I think, in exchange for those dollars. So I guess I don't know if anyone else has comments on this. If, Chief, do you have any? You've been working through with Catholic Charities quite a bit on the delivery of some of these services. I mean,
Sure. We've had, over the course of the history of that contract, different times that we've called in their leadership. I think it's fair to address some of those challenges their leadership has had, which, part of an organization performing well is having the right people in the right positions, and that there's continuity within those positions, and they've struggled to keep leadership staff in place with the right vision moving it forward. I think there is a significant will on the part of Catholic Charities to provide great services and connect people to those resources that are going to allow them to leave homelessness. I think it's fair to say it has not done that. What you are getting for your dollars is emergency shelter for up to 30 people a night when we're funding that. And then the day center, we even tried to lower the barriers in partnership with them so that showers could be utilized during the day, or people that didn't get a bed the night before could rest their eyes or sleep during the day, with a hope that it would take some of the pressure off of other places in our community, our downtown, our parks, our library. It just doesn't seem that it's all that popular of a place to be during the day, and the attempt to bring other partners in and use that day center to push people to resources just really hasn't come to fruition. Mm-hmm. So I think that's through my lens when I look at what's effective and what isn't. They're open in a day center, but you'll notice in some of the the testimony or the answers, like there are times where there's nobody there, or there's a couple people there, or at most there's 6 or 8 people there, where I think our vision when we were discussing that in the first place and the council made a decision to fund it is, it'd be great if there were 20 or 30 people there during the day and they're doing something productive, or at least they're not being unproductive or negatively impacting our downtown. And unfortunately, that just hasn't been the case with the day center.
Yeah, I think that's the impression I've gotten as well. The one thing that we talked about in our task force a number of times was barriers to entry. We obviously don't want barriers to entry that are so restrictive that people either can't get in or don't want to go there. But by the same token, it can't be a situation where, a person is just existing in a continuous state of, misery basically, and not even getting into some sort of programming. Not that you can require programming on day one as an admission requirement, because we would never expect that. But when people are ready to avail themselves of help, there has to be a consistent schedule of offerings that somebody could partake in. And I think that's where, our concerns lie was, are there certain times of the day and certain days of the week that there's routine cyclical office hours where somebody can access services? I mean, they do have access to Tracy. She meets people there and that, but as far as other agencies, there is so much help available in this community. And, for her to be one of the few conduits that is connecting people to all of these different offerings makes it all more difficult. It makes everyone's job more difficult. So, I think what we were looking for was routine offerings that we could measure and then some measurable results. I think that's the hard part. Lou?
Do you think we'll have some measurable results after winter is done? I mean, obviously, I'm just assuming, my 2 questions would be, is the day center not having the business because of its past history, for one? And for 2, are they not getting the business because of it's not really cold outside yet?
True on both counts. And the other thing we don't know is, as we start to go forward with this service agreement, one thing we have not looked at since we began down this road when we had to switch providers was, is there any option for any other providers? We don't know. We are of the assumption right now that the one we have is the only one able and willing to provide service. I don't know that that's the case. And so, I think that in some of these discussions, part of our work should be during these winter months, an analysis of whether or not there are any other nonprofit facilities that could assist us or co-assist us so that maybe there isn't only one venue. There may be other agencies that could offer day services as well, that could offer it with some, I guess, consistent programming, and then which would generate consistent service numbers. And I think part of the situation too is the environment there has to be conducive to recovery and say it has to feel safe. People have to, there has to be an element of trust and safety in the facility for people to want to go. And then they have to also feel like they are, welcome, wanted, and part of something. And it's not that we have this lofty vision of what it should be, but right now we have no way to measure. We know what it's not, I guess, is where we've come down right now. So
2 quick points.
Sure.
To answer your question, Mr. Larson, yes and yes. I agree with the points that you're making there. I would say that it is a respite place in the winter to get out of the cold, so it'll be interesting to measure what the daily census rate is. It's tough to measure, though, because someone walks in for 20 minutes, they count, and they're open all day. But I'm also optimistic. I know that any organization, if they get a great leader in there that can develop trust and address all the issues that Alder Rasmussen just discussed, and I received an email. I haven't had the opportunity to meet their new director that they've hired to take over this area and have stewardship over that program. But I don't think it necessarily takes a long time to turn something around and build that trust within a population. So I'm optimistic that we'll see good things come out of that.
I agree. Committee members, how do you feel about approving an extension then to get them through the end of April? And then during that time, they'll be having these discussions about what a service agreement with deliverables would look like.
I'll make the motion to move ahead.
Okay, so we have a motion from Larson for just that purpose. Extend funding per Tammy's proposal through the end of April, and then return the rest of the funding to finance to allocate with ARPA. Second by Watson. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye, opposed? None are opposed. Thank you, everyone, for your work on that.
Thank you.
And we got
Thank you for
Tammy
letting me
out
go
just in
first.
time. Thank you. Thank you, thank you. Item number 3 is to consider approval or denial of various license applications. And so you have those in your packet. I have to switch back. I don't think we had any denials recommended for this month, did we? So it's rare when we don't, but we don't have any. A couple notable things. You've got some events on there, some normal renewals, nothing too out of the ordinary. Does anyone have any questions on anything they see in the batch? If not, I'll take a motion to accept or deny licenses as recommended by staff.
I'll make the motion to approve the licenses.
Okay, motion from Larson, second. Second by Lukens. Further discussion? Members in favor signify by saying aye.
Aye.
Aye, opposed? None are opposed, that motion carries as well. Item number 4 is a hearing. It's an appeal of a declaration of chronic nuisance premises at 1013 South 3rd Avenue. And so in our hearing setting, we operate with 2 attorneys, one that is representing the city, the other one that's representing the committee. So we'll bring up our city attorney to work with the committee, and then our assistant city attorney, Tegan Troutner, will work with the city departments. So we'll just shift gears a little bit here. And then I'm going to shift over to the packet so I can see the documents for the hearing. Loading, slow though. Okay, and the owner of the property at 1013 North 3rd Avenue is a Chad Thompson, doing business as C&K Thompson Properties. Do we have Mr. Thompson with us this evening? Chad Thompson? Because he is allowed to appear and bring witnesses if he so chooses. Okay, let the record show then that Mr. Thompson has not appeared to represent himself or brought any witnesses to this hearing. Ms. Troutner, you have witnesses that you would like to present to us for the declaration?
That's correct, Alder Rasmussen, and I would also ask that given that the property owner is not here, that rather than going through with evidence, that the committee just deny the appeal based on his failure to appear today.
Okay, that seems reasonable. Committee, is it your desire to hear testimony and see evidence tonight, or given the fact that the appeal that was filed by the owner really becomes moot if the owner is not here to offer evidence or testimony, are you content to just confirm the designation of chronic nuisance premises? Because we won't swear in the witnesses if you are not interested in going through with the whole hearing. Go ahead, Lou.
I don't see a point of going through the whole hearing if the owner of the property that's in question is not here, and just shows that he doesn't care one way or another.
Well, it is difficult to do it one-sided for sure, because you
Yes.
can't hear both sides of the case that way. So with that then, that makes this entire hearing process a whole lot shorter. And so,
And it's also the city's understanding that the property owner was provided notice.
yes,
the
it's my
hearing.
understanding that he did receive that notice. And with any quasi-judicial hearing that we hear in this committee, we certainly give the option for the witness to either offer testimony and evidence exhibits or bring other witnesses that we would swear in and allow them all the time they need to present their side of the situation. So the fact that that has not occurred tonight certainly makes sense that we would then not go through this entire process. So with that, we then either have to affirm or deny the designation or declaration of chronic nuisance premises at 1013 North 3rd Ave. If your will is to affirm that designation based on the lacking completion of the appeal by the property owner, you could make such a motion.
And I'm also happy to provide a recap of what I believe the expected testimony from the police department would be if you would like that prior to
I think that's
voting.
helpful to us, if you want to
Okay.
just give us a brief, especially since we do have members of the public that tune in, and I think that makes all of this easier to understand if they know kind of what took place.
Sure. So, where did I put it? So, Officer Grund would have tested. Did I say that right? Grund. Grund. I always say it wrong. I'm sorry. I think there's an umlaut there, but there's not. All right. Officer Grund from the Wausau Police Department would have testified this evening that he is a member of the Community Resource Unit. And as part of his duties, he received an anonymous tip on a property located at 1013 North 3rd Avenue in the city of Wausau, and that was with a specific apartment number where there was an anonymous tip. And the tip was that there was some suspected drug dealing occurring in that apartment complex. And he would also testify that the building is also a commercial building as well as an apartment building. So it's not just people living in the home, but there's also businesses that are there as well. Officer Grund would also testify that during his surveillance, it was not just him who was surveilling, but there was a whole group of them with the CRU unit. So the Community Resources Unit, they call it CROW. So I'm just going to use that because it's a lot easier to say than CRU. So the CROW unit, they conducted some surveillance on the property. And on September 20th of this year, what they observed what they would consider short stay traffic. So this is often correlated with drug dealing and drug trafficking. And so they observed a vehicle arrive at the property and then leave shortly thereafter, arriving at the property and entering into apartment number 13. And so after the individuals left the property, there were 4 people in this vehicle, and a traffic stop was conducted based on some traffic violations that were observed. And during that traffic stop, when they stopped the vehicle, there was a very strong odor of marijuana that was emanating from that vehicle. And based on that, there was a search that was conducted, and marijuana was found in the vehicle along with $2,351 in cash. And that is also correlated to drug use and drug trafficking, distribution. So after this stop was conducted, Officer Grund and members of the CROW unit contacted the owner of the property, a Chad Thompson, and Mr. Thompson indicated the individual who was renting the property as a resident of that property. So he just kind of confirmed the tip that yes, this person who was identified as the dealer was in fact living there and had a lease in that property. And so after reviewing all this, the CROW unit executed a search warrant, and in the search warrant, there were individuals that were identified with the property who ended up being charged with marijuana possession, cocaine possession, and drug paraphernalia possession, as well as possession with intent to deliver, which is a violation of Wisconsin statute 961.41. Mm-hmm. And if you look to the chronic nuisance statute, which is 924.070, subsection B3, states that a chronic nuisance premises means a premises that meets any of the following criteria. And the specific criteria says that it's a premises which has had one enforcement action resulting from the manufacture or delivery of controlled substance or related offenses as defined in Wisconsin statutes chapter 961. So Officer Grund would testify that based on the search warrant and the execution and then the individuals from the traffic stop, that there was in fact a distribution occurring out of this apartment number 13. And so as a result, the police department and Officer Grund, he provided a notice on the property on September 25th of 2024, informing the property owner that this was in fact a designated chronic nuisance premises, or that it was declared a chronic nuisance premises based on the violation of an individual being charged with maintaining a drug trafficking place, possession of THC, possession with intent to deliver cocaine, and possession of drug paraphernalia based on that search warrant and the traffic stop. And
it makes sense.
Yeah.
I mean, when a number of years ago, we adopted chronic nuisance premises designations as a tool specifically for both inspections and police to use to address premises that really put forth the behaviors and conditions such that they really can detract from the quality of the neighborhood and really from the use and the enjoyment of the building for everyone else that's there. And so we've seen it both with uncured inspection situations as well as drugs and drug dealing before. It's not something that we see designated on a daily basis, but it is certainly a tool and a deterrent for landlords who have this type of activity occurring in their premises to make sure that they are taking action when they're made aware of those situations and, really then screening their tenants properly or screening their renters properly. So
That's correct.
Yeah.
And this designation would only last on the property for 6 months. So if there are any violations, further violations on the property for drug trafficking or anything that's associated with Chapter 961 of the Wisconsin statutes, that would just give the police department an opportunity, or it's just another tool for them to deter that. And so what they
Yeah.
would do with that is that they could cite the landowner or the property owner if there were any issues within that 6 months. But in this case, there's been no citation that's been issued. It's just the designation that's been posted on it.
Right.
And after 6 months, so 9/25, whatever 6 months is from there, the designation would go away.
Yep, end of March. So with that, Lou? Go ahead.
Question, yes, what happens once a property is designated a nuisance property? I mean, what goes on, I guess, for the next 6 months? Is there
Yeah,
constant
so,
patrols there? I mean,
Well, it opens up some new avenues for them to recover the cost of enforcement and repeat visits, I think, right? So,
yeah, and it's basically a tool for the landlords actually to prevent that kind of activity on their property. So with that designation, they're allowed to evict who's ever in the property and whoever is on the property, and they don't have to do it through the rigorous eviction process that's required pursuant to Wisconsin statutes. They can do it under the 5-day rule, so you just say, you're out, kind of thing. Whereas they would have to do something different if they didn't have this designation.
thank you.
sure. Okay. Yep. And so with that, and the fact that the property owner has not appeared to present his half of the case, then I'll take a motion to, if your will is to affirm the designation on the property, I'll take a motion as such.
I'll make the motion to
Okay.
affirm the designation of,
So we have a motion from Larson. Is there a second?
I would second.
Second from Watson. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye. Opposed? None are opposed. That motion carries. So thank you, everyone.
Thank you.
Yes, please. Yep. And so what Ann will create is a document that's the findings of the committee that we've affirmed the designation. I'll sign that, I'll file it with the clerk, and she can provide it to the owner. So much like we would at the end of the hearing, had we had to complete the entire hearing. So same documents. Item number 5 is discussion and possible action amending Section 5 of Ordinance Number 61-5950, striking the sunset provision of December 31st, 2024 on Wausau Municipal Code, Section 9.20.02, Sub T, making consumption of alcohol in parks under certain conditions a municipal offense. And you'll recall a while back, we did a trial. We wanted to see if we have an alcohol prohibition ordinance on our books that really make it a violation to consume alcohol prior to 4 p.m. on the 400 block. And so as a result, we were seeing things in other parks and at other public spaces where we felt that a trial of something like that everywhere would not only make it a little bit more fair, but it might make sense and it might help with some of the problems that they were seeing in the areas. We put a sunset on it because we wanted to come back at the end and see if it's been effective. If it's effective, we have the option to make it permanent. If it's not, you don't. But we have received a request from Wausau PD to remove the sunset date and make this item permanent, because I believe that we'll hear from them today that having that ordinance in place is helping. So, Chief, I guess, did you want to start us off?
Sure. Please remove the sunset because it works. It worked,
There you go.
It worked on the 400 block. It's working in the rest of our parks. It gives us a tool when we go into a park, and generally speaking during the day, the behaviors that we see when we have no prohibition against open air drinking are not family friendly. They're not what we want to see in our parks, and it gives our staff the ability to go in there and make a change. With us tonight, we have our 2 officers that are assigned to our parks in our downtown and assisting, trying to improve the quality of life down there, Officer Porath and Officer Harish, and they, of all of our staff that are enforcing this ordinance, they're the ones that are down there during the day. I think the chairwoman's words were like, in the eye of the hurricane, they're the ones standing down there.
Kind of,
And-
yes. And I guess there's value in us hearing from them. I guess if you guys want to come up and talk to us about what your experience has been, we would love to hear from you since you've been at it for a little while now and seem to be really making an impact. At least that's what I've been hearing out in the community. So, welcome.
Thank you for having us tonight. As the chief had stated, this has been a very effective tool in our mission as the downtown officers to increase the quality of life in our downtown area, not only for our citizens, but our businesses and out-of-town visitors as well. So beginning in May, when Officer Harish and I began this position, this was one of the tools that we started using in earnest with the parks in our downtown area, because we were seeing quite a significant amount of calls for service for disorderly behavior, fighting, just the type of behavior we don't want in any of our parks, let alone in our downtown where we've seen a lot of issues. So Officer Harish and I began our efforts by educating the people that we contacted in the parks that were having issues with consuming alcohol. We educated them first by giving verbal warnings, explaining the ordinance. Then we moved on to issuing written warnings, and then we moved on to issuing citations after it was very clearly explained to our regular inhabitants of the parks of the expectations. Since we've had a marked enforcement in this ordinance, we have seen quite a significant change in behavior for the positive. We've reduced the amount of calls for service due to excessive intoxication at all times of day, especially during the daytime. And we've also seen people decide, okay, I've got my ticket, I'm not going to return to the park and drink. And we're fine with that because some of those people were some of our most significant causes of issue. So.
Yeah, I would echo Chief Barnes's comment that it has worked. It's allowed us to gain some teeth in our efforts to try to see the change in behavior that we want to see downtown and in our parks. We have arrangements with both the city attorney and the district attorney where individuals that are repeatedly violating this ordinance can find themselves in some other hot water, which gives us just more tools to try to build up, give us the ability to paint a picture of somebody's history, which allows us to get creative if things eventually get to a criminal standpoint. Or we've also seen great success in getting some of our most frequent offenders successfully into treatment programs, and we've seen people get into sober living or different housing situations. I would hear the concern that we don't want to be hammering on families for going to the park and trying to enjoy a beer on a Sunday. And there's still discretion allowed with this ordinance. And those are typically not the people that we're having contact with when there's calls for service. We might respond to a park for a fist fight or some other sort of issue. And the behaviors and environment are much different. And again, we're typically not dealing with the behaviors that we want to see in our parks. So maybe someday down the line, things are in a better position. This wouldn't need to be a permanent ordinance. But as it stands now, I mean, we have been seeing a change, and we're starting to see that shift where, like Chief Barnes said, seeing what we want to see in our parks more frequently and seeing what we don't want to see in our parks.
Well, when this idea debuted, I know for some time, there's been, some other municipalities who have either passed complete restrictions or have never allowed consumption in public parks. And they've had some success, or at least haven't struggled with some of the things that we've struggled with as a result. So it certainly made sense to try this. And I think from the time that you all began this effort, it was understood that it was a combined approach. It was a two-pronged approach, enforcement and care, or at least connection to care. And so I think that working at it from both directions, and maybe getting that enforcement arm to get individuals to realize that maybe is a wake-up call that's necessary to get them to grab onto that helping hand and maybe look to move to that better position. What we've always talked about as a committee is we want you to have tools in your toolbox. You all control when you use them and which tools you choose depending on the situation. But it really is incumbent upon us to make sure you have the right tools. Whether that's policy tools or equipment, here we are. So this really, it seems to be showing itself to be a policy tool. Alder Larson.
Thank you, Madam Chair. One question I would have to ask is first of all, thank you for all you're doing, and it seems to be working, and I'm in full support. But I have a question. Does this ordinance give you the power to confiscate a violator's alcohol during the day?
Under certain circumstances, yes. We did work with the city attorney's office to determine if that was something that could be done or should be done. And in certain circumstances, yes, we can confiscate the alcohol. It is not destroyed because it is legal to possess alcohol if you're over 21. So there is a process for the person whose alcohol has been seized under certain circumstances that they can go through a process to get that back.
Sure. But I mean, say like, okay, this guy's got a case of beer and he's jagged up at noon. Can you issue him a ticket and take his case of beer away because it's in the park?
Yes, we could. There have been a couple instances where we have seized alcohol to get the point across to some of our more challenging citizens. And taking somebody's $3 can of beer actually had more effect than the $120-something ticket they received.
That's the point I was getting at, yeah.
So
thank you.
it is an option. We have used it very sparingly. I think we've used it twice, and I was the officer who did it twice after we consulted with the city attorney. And I don't believe we've seized any since. And on a side note, the one person that we did seize it from, we have not had issues with him in the park consuming alcohol since then. So
Alder Larson, it's far more frequently, is my understanding, where they show up down there and there's a case of beer and they will say to everyone, "Whose beer is this?" And everyone says, "Not it." And so in that particular case, it would be inappropriate for our officers just to leave a case of beer sitting unattended in a park. So that beer would come with us and be destroyed at that point.
Okay.
that
Thank you.
actually just happened today with a
It
bottle
just
of vodka
happened
that
today?
magically appeared in one of our parks, and
Oh, geez.
nobody wanted it, so it got dumped out in front of all of them.
So there you go. But yeah, I think that, the approach that you're taking with some, I guess, discretion for what tools you use and when, that's the key. And, that really has been the key all along. And, I think that as a committee, we were willing to trust right away that you would know which tools to employ and when to get the best results. And it really does seem like that's happening. Go ahead.
And if I may add something, I don't want to jump the gun to the quarterly report, but we were asked to provide some information about what we've been doing in this position, and we highlighted one of our success stories in that report. This was one of the first people that we cited frequently for prohibited alcohol before 4 p.m. And ultimately, with that, along with some other criminal behavior in our parks, she ultimately sought to get rehabilitation and completed an intensive inpatient program, which we can speak to later if you'd like.
Sure.
Reference that report.
I think as part of the report, we would value that insight. Chief?
I think it's important to clarify one point, and our staff do have discretion, and we generally like to use the least restrictive amount of enforcement necessary to change behavior. But I just want to be clear that if there is a family of 4 down on the picnic, they're having a picnic in our park at 11 o'clock in the morning, and one of the adults is drinking a beer, they're not allowed to do that. And we inform them they're not allowed to do it. It just so happens almost every single time in that scenario, informing them of the ordinance and giving them a warning causes a change in that behavior.
Sure.
It's very infrequent, but like, nobody gets a pass to violate the ordinance.
I think
It's
that's
what the enforcement is and is necessary.
That's
is
important. I think
changes.
when we first employed this, we had some discussion at the council level about fairness and rolling it out to all parks and whatnot, versus using a targeted enforcement zone and whatever. And I think it's helpful because that just makes the tool more useful as well. If you would find that you have issues in neighborhood parks also, and that could be anything from underage consumption to the similar behaviors like you're seeing in the other areas, it helps that you have something that you can, deploy in other spots too and use it. So thank you so much for that. And with that, we've taken a motion and a second, right? We have Larson and Watson to remove the sunset date. With that, is there any additional discussion or questions? If not, then those in favor signify by saying aye.
Aye.
Aye, opposed?
I don't think we did
Oh, I
have a
thought you had
motion
the
or
motion and a
second.
I don't think we did have a motion either,
okay.
Yeah.
but I
Okay.
will make the motion
Let's,
that we
yep, let's
remove the
take one then.
sunset.
Sorry, I'm ahead of myself. So we'll take a motion to remove the sunset date from Larson. Do we have a second?
Okay, I'll second.
Second by Lukens. Sorry. With that, members in favor signify by saying aye.
Aye.
Thank you. Aye. Members opposed? No, and that item passes. Go ahead,
I just have
Tegan.
a clerical, because I drafted the ordinance and
Okay.
I realized that I made it a joint ordinance of the Public Health and Safety Committee and Parks and Recreation Committee because that's how it was when it came to the committee.
Mm-hmm. Right.
But I know at the council meeting, the discussion was that it would just be Public Health and Safety that would hear it. So
Yes.
is this something where you want to send back to Parks and Rec, or do you just want it to be an ordinance of PHNS?
I don't think that it was their desire to have it back a second time. I think they wanted us to analyze the effectiveness, which we did also with a number of the enabling ordinances that we created to surround COVID. So,
Okay.
go ahead, Luke.
Then I can
Oh,
just
and the
make
Parks
that-
Chair is here.
The
so-
Parks Chair is here, and I would be okay with just keeping it here at Public Health and Safety. I'm sure
Okay.
And that's what.
there's other committee members here too that I'm sure would be okay with it. We don't need to discuss it, beat it up twice, and then bring it to council.
Sure.
Okay.
Okay.
And then I will amend the heading so
To
that
bring it from just
so
us.
that it's accurate.
That makes sense.
Yes, indeed. Thank
Okay,
you.
thank you for that.
Thank you.
Thank you. So that brings us to item 6, which is discussion and possible action on approval of emergency management services agreement between the City of Wausau and Marathon County. This is actually something that we receive on a routine basis. Let me just pull up the packet. Does anyone have any questions on this emergency service agreement? I want to say that this comes around like every other year for us. Go ahead,
Sorry.
Chief.
So I stumbled across these two going through the budget. They're, the last one was 3 years and it expired in January of this year.
Okay.
So speaking with Mr. Leonard up at the county, we just decided to update it and send them both across for another 3-year term.
And continue it, sure. And no changes to the provisions, so
Just the dates.
just the dates. Anyone else have questions on that at all? If not, I'll take a motion to approve.
I just.
Go ahead, Tegan.
Sorry.
Sure, you're fine.
I don't, did someone from our office review it, do you recall?
Yeah, I sent it up to Lisa.
Okay.
Okay, so with that, we'll change the dates and extend it for another term. Do we have a motion for that extension? Motion from Watson, is there a second? Second by Lukens. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye, opposed? None are opposed, that motion carries. Okay, toggling back and forth between the packet and the agenda. Okay, so that brings us to item number 7, discussion and possible action on approval of Level B hazardous materials response agreement between the City of Wausau and Marathon County. Same situation here, right? We are the regional hazmat team, and so we keep these agreements in place, and this one also would just renew and true up a new set of dates, correct, Chief?
That is correct. The only thing I would state that this particular agreement is just for the countywide. So while we are a regional team, that this really is a level below that, meaning that we will cover all hazmat calls for the county as well as the city. And then when things extend to the emergency level of a regional team, that's when we would activate that part of it. But
Sure, and that's under state agreement, right?
Correct.
So, okay. Does anyone have questions for the chief on that agreement at all? If not, do we have a motion to accept that renewal as well? Motion from Lukens, is there a second?
I'll second.
Second from Larson. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye, opposed? None are opposed, that motion carries also. Item 8 is a community care and safe station update from Wausau Fire.
So with the Safe Station update, I asked EMS Division Chief Jared Thompson to come in and give you a little update of that initiative, and then I will give you guys an update on the community care paramedic.
Excellent, welcome.
Yeah, thank you for having me. Always excited to talk about enhancing our cardiac arrest survival and our ability within the city. So I set out to accomplish a goal, and we're still in the infancy stages of becoming a heart-safe community, which is governed by the CPR Citizens Foundation. And they have established a set of guidelines and criteria to enhance out-of-hospital cardiac arrest. We as a fire department, we throw a lot of resources and technology at cardiac arrests on a daily basis when they come in. And cities and communities that have met this criteria and guidelines have actually saw an increase in their out-of-hospital cardiac arrest survival by empowering and enhancing the community to take the first steps of the chain of survival, which is early recognition of an out-of-hospital cardiac arrest, early activation of the 911 system, early CPR, and early defibrillation. So one of the biggest hurdles in gaining this distinct criteria of becoming a heart-safe community is public access AEDs, because there was a fee, which we got covered by the Community Foundation, as well as logistics, and that's when we partnered with the Parks Department, Jamie Polly and her staff, who helped us get those installed and collaboratively worked together with a grant, and we received over $16,000 to purchase 4 safe stations that included very user-friendly AEDs for the public to utilize in the case they witness a out-of-hospital cardiac arrest. So those were revealed in mid-September, and are out. One is at the 400 block. One is down by the River Life by the Wow Center, which are nice because they're by surveillance cameras. We've had, I think, one individual that wanted to see what was inside of those safe stations, and when that does occur, it has an audible alarm, and it also flashes pictures, takes pictures of the individual. And the lieutenant that was on duty at the police department saw that through the cameras and dispatched an officer who was able to connect with the individual that had some questions about the safe station when they opened it up, and was able to relay that it's for emergency uses only, and that's about the only incidents we've had so far with that.
Excellent. Additional questions, committee members? So, excellent. Something to celebrate in the community, so I'm glad to have those. So, all right. And then
Jared.
we'll switch over to the chief for community care.
All right, so some of you may or may not know that we onboarded our community care paramedic in the beginning of October. His name is Matt Kozlowski. He comes to us from outside, but he was an inside firefighter paramedic a few years back. He had 7 years on with the Wausau Fire Department, and now he's back for this term as a community care paramedic, which turns out to be a huge passion of his. I did invite him to come here. He's unable to make it tonight for this presentation, but I will be bringing him back frequently to keep everyone updated on the progress. And I'll just read you some of his notes that he had ready for tonight. He has meetings underway with Aspires Hospital leadership and the Wausau Fire Departments to continue designing how the program will roll out in the coming months. Community care paramedic Kozlowski has been working on building the software program he'll be using to customize the treatment for each of his patients to track the appropriate data. This data will be used to ensure we're on target to reach our goals, justify our efforts, and to enhance the performance of the program. Matt has begun meeting and collaborating with our local resources to address the specific needs of our community. A lot of those agencies we're all familiar with. And then we've begun the process of identifying and researching and ordering the necessary equipment for the position to be successful. So he's been very busy in his first few weeks. Obviously, the patient contacts aren't there yet, but we knew that would take some time as we build this whole position and set our goals and objectives as we move forward. So far, so good, and everything's on track to what I believe will change our community tremendously.
Excellent. Anyone have any questions on that at all? Okay. If not, then we'll place those reports on file, and then we'll switch to item number 9, which is the Wausau Police Department Quarter 3 Operations Report, which is contained in the packet. Anything that you wish to highlight on that report, Chief?
Yeah, I'm more than happy to answer any questions about the report. In about a year, the council will have to make decisions on what to do with our downtown officers. I would just state that I'm very proud of the work they're doing, the work that the department as a whole is doing. And one of the concerns that really, when that was debated over multiple meetings and lots of people came, is the criminalizing of homelessness and what is that going to look like. And I just want to highlight in your packet, if you read the story of Jane, the work that our staff are doing with deflection. We don't tolerate bad behavior or people violating the ordinance or the laws in our downtown, but just as much, if not more, work is being utilized, getting people to resources and finding what is going to work for that individual and building trust with them. So I would like to invite them back up, if it's okay with you, Lisa,
is, yep.
just to talk about some of those resources that they're utilizing, like the diversion program, that is really making a difference, probably one person at a time, but that's the only way in which we can do our work. So, gentlemen?
Yeah, come on back up. So I'm glad that that report actually is posted to our packets as well, so that the public can see it. I think that the case study that you identified with Jane, just talking about the sheer number of calls that she had been involved with before, when you think about the time and effort that goes into 115 police responses, that's huge to have that reduced, so.
Well, anecdotally, trust me, guys, I'm not hiding and doing surveillance on the work you're doing, but when I go downtown and business owners recognize me as the chief, the frequency at which I got complaints prior to this about the atmosphere downtown, where now when I go down, I'm getting compliments to our department and these gentlemen and the work and the difference that they're making. So that's my anecdotal measurement. It wasn't always fun to walk downtown as the chief of police and listen to your constituents. And now it's significantly, I enjoy myself.
Yeah, I've had similar interactions with downtown employees that knew that I've been working on this in the committee, and that, obviously chairing the committee, I've received similar concerns when we were at a heightened level of concern. But conversely, I've received also positive feedback about their work. So I'll echo that as well. Welcome.
Yeah, long time no see.
Right?
Yeah, just to touch on that case study that was in the quarterly report, even leading up to this most recent year that racked up those 115 calls for service, this is somebody that we've encountered with for similar issues for closing in on a decade. And this is an individual that, no matter how frequently you would encounter this person, had no interest. Moved up here from another central Wisconsin small town for the resources, but for almost a decade had no interest in sobriety, treatment, housing, help getting a job, was kind of just looking for somewhere to comfortably be perpetually homeless. As Nate said earlier, she was one of the first individuals that began to receive citations for this alcohol ordinance, which again made a tremendous difference. And repeated offenses with that allowed us to work with the city attorney and the district attorney to eventually look at it from a criminal standpoint, which gave us more tools like bond conditions, things like that. And brings us to talking about diversion and deflection. Oftentimes we are able, when someone has issues with substance or alcohol abuse, to introduce them to an individual that can talk about treatment or get them there or have it paid for through some sort of funding. An unfortunate truth is many of the individuals that may be perpetually violating ordinances or statutes in our parks or downtown areas may not have an interest in that unless there's some sort of component hanging over their head that is more impactful. Like if you have to sit in jail for a year, it's hard to use or drink. So unfortunately, a lot of times, a criminal component being present is very helpful for people to say, hey, there is another path, and that can be a door opening that is a fantastic way. Somebody's in jail for a couple days, they're able to meet somebody from the diversion or deflection program and get assessed and maybe find a different path. Something we do on a daily basis is if we're out with an individual, whether it's a call for service, somebody's getting arrested, somebody's getting a ticket, or we just see somebody and we're stopping out to check in with them if they're drunk, high, even if they're not and they're just a user. Nate and I regularly ask people about if they're interested in sobriety or treatment, and a lot of times we bother people day to day, and a frequent answer we hear is, no, not today, but keep bothering me. And when that day comes where somebody is interested, they have a connection. Typically, we have a member from the diversion or deflection program come out in the field to meet with us while we're out with the person, because we're not under any delusion that if we gave somebody a business card that was incredibly intoxicated in a park and said, hey, call this person if you ever want treatment, they're never going to call. But some of the connections that we've seen build between some of our clientele and the folks from the diversion program have been pretty impactful, and they've helped a lot of people get into treatment and complete treatment. Sometimes people leave early, sometimes people fail or relapse, but that's part of addiction. It's a lifelong battle. So they offer an out that, if done correctly and the people take it seriously and the support is there on the back end, can be a lifelong improvement and set them on a better path of life for whatever years they have left.
I know Mike spoke a lot about our connection with the diversion program and resources, but I know they asked us to keep the quarterly report summary rather short. I didn't get to highlight some of the other connections we've made in our community that have been making a big difference. We've got a great working relationship with the Parks Department because a lot of this negative behavior is occurring in their parks, causing damage, criminal damage, vandalism, causing resources to be wasted on their behalf, having to come out to the parks frequently. So we've built a great working relationship with that department, and we've gotten positive feedback from the staff at the Parks Department all the way up to Jamie, commenting about the difference it's been making in the parks and our efforts. Because we are frequently going out into the parks, even if it's not a call for service where somebody has called us and reported an issue, Mike and I are out there daily, going to the parks, going to the locations where we know a lot of our citizens who are having issues with homelessness or addiction, where they frequent. And like Mike said, we'll just check on them and make those connections. We've built a rapport with a lot of our unhoused population, and first name basis with us and them, and so we've also built that connection as well. And then tying into that too, we've developed a very good working relationship with the director of the CPC in addressing some of these issues as well. So.
It's excellent. And when we read the narrative, I mean, I come back to the narrative that's in the report and some of the terms that were used by the deflection agent when she talked about Jane's case was things like communication and warm handoffs and humanizing work. And so, despite whatever effort was made to really, I guess, vilify the effort of positioning law enforcement in our downtown to try to make those connections, yet with an eye to enforcement of the ordinance we have to deter behavior, the fact that the feedback we're getting is really talking about the fact that there is that humanizing care component. That really, I think, speaks to the quality of the work that you do. That it's not just enforcement, it's not just pushing a problem from one location to the other, or not even a problem, but a situation, like you can't be here, but well, go over there, or you can't be here, well, there's somewhere else. And so that's not what we're seeing, and we're not seeing the situation where, people are not directed to resources, and I think at one point there was, just comments made as we first considered this about, criminalizing homelessness and the enforcement at least having a perception of some level of harshness, and that's just not what I've read about here. And, I think that is really a great testimonial to the work, of both of you guys and the department, that, ultimately it is a two-pronged solution. And I think, like you said, if you have the court mandate or you have the criminal charge element looming, it may incentivize someone to accept that helping hand, where otherwise it may be easy to just not, And I think, what I've heard from some folks, I've talked with a couple of downtown employees, and, I've talked about the fact that when someone is in that cycle, it really becomes sometimes a matter of choose your hard, because both are hard. It's hard to exist in the state that they're in when they're found. It's sometimes harder to get on that path to a better place and stay on it, because that too is painful. And so I think that, making those contacts and those check-ins, and, the fact that someone will say, well, I'm not ready for help today, but don't stop asking me. I love that, because at some point when that person says yes, you can help them. So I'm just very proud of what I see here. I guess committee members, do you have any thoughts?
I do.
Go ahead.
This is my second term on this committee, and, I think back when we were invited to go down and tour the downtown.
Under the bridge.
Under the bridge, and with the homeless encampments and stuff, and I think that was for me as a council person, as a committee person, one of the hardest decisions I had to make was to vote to get rid of those. But at the same time, they were choking off our downtown. And I think that was probably the start of where we're at today. And I think that, it's as a collective unit, it's seeming, look at the leaps and bounds we've made in just a few years. And so not only am I proud of our police officers and stuff, but we all need to give ourselves a pat on the back too for recognizing the problem and giving our officers and stuff the resources to help with a clean and safe city to live in. And thank you. That's all I have.
Sure. No, it's helpful. I mean, it's helpful that we give them the right tools and the right policies to use. I think it's also helpful when units of government recognize a need or recognize a situation, but then also are willing to take a chance on solutions. A couple times in this committee, both with the park alcohol ordinance, with this effort, with a number of other things. The department has come to us and said, we recognize this is an issue. We'd like to try this. We'll let you know if it works or not. This is another case just like that, where you've brought us an experimental idea, and it turns out that it is making the impact that we wanted it to make. So that's huge for us. I think as a committee, it's difficult for us to take credit for it, because all we did was vote yes. And that's the easy part, really, because to actually go out and perform that work, that is really where the task lies. So really proud of all of what you guys are doing down there.
And if I may make the offer, I know I spoke to the chief about this once before, rather than hearing this secondhand from citizens or from us coming to the committee, if any of the members here, or even the whole council, the mayor, whomever in the city government ever wants to see firsthand what we're out there doing, you're more than welcome to contact us, and we'll take you on a ride along and show you what we're doing and how we're interacting with all the citizens in our downtown area.
Tell them the truth, though. You put on a lot of steps every day, so that's more of a walk along.
Right. So bring your
Yes,
pedometers.
Yes, there may be a lot of walking involved. We'll see when it gets colder how many steps are involved. But
Yeah.
again, if you want to see firsthand the connections we've made, not only with citizens, whether they're housed or unhoused, and our businesses, I think firsthand is
I think it's
a lot different.
I think it's helpful. I think I would encourage members to schedule those ride-alongs or walk-alongs individually. I think it's less daunting for the folks that you interact with to not see you with an entourage of
yeah.
12 politicians.
Yeah, definitely. I would
So-
recommend one-on-one.
One at a time, but I mean, yeah, I think that's a valuable experience for us to have. I mean, we did take the bridge walk as a group because it was a meeting, but, that said, also, I think that there is some, perceptions if we all show up together. So I think individually, though, there'd be value if folks are interested in seeing, exactly what happens, whether it's from our committee or the council at large. It's certainly well received. So, anyone else have comments? Okay. Anything else on the quarterly report, Chief, that you wanted to go over?
No, that's good, unless there's any questions about it.
Anyone have questions about other elements of the report? If not, we'll place that report on file. Item 10 is the Fire Department quarterly report. Anything on that report, Chief, that you want to review with us?
Unless there's questions, I highlight a few things, and I'd be remiss if I didn't bring up the two words that eat up most of my time lately, and that's recruitment and retention. I'm always looking for new ideas and different ways and getting the word out there because, the fire service in general is struggling, but us here in the city of Wausau are really going through a slump here that's really trying of our membership with the overtime and the workload that's been placed on them right now. So, recruitment and retention is job number one right now, and mostly recruitment, but retention's also fitting in there. So they bring that up. And another thing I would say is, as you read through this whole report, the one big word that comes out for me that I would notice in a lot of it is collaboration. If you notice, we're collaborating with a lot of different businesses and community leaders in our city, as well as our local departments, to help us train and do different things that we were unable to do before we reached out and made these partnerships. So those are really the only things I wanted to point out right now.
I love that. I love also that your active social media presence, I think, is really getting the word out about the quality of the department, the work environment that you provide there. I think you've made yourselves a destination department, as has the PD. I think it helps to get that word out. You've posted photographs and video of your training exercises and, things that really, if we rewind 10 years, we'd have never had that. And so, I think that that presence is helpful. I think you also all competing for the same pool of candidates. We talked about that earlier this year when we had the governor up here. We talked about our training program and our possible collaboration with NTC was that fire departments statewide all need people. And, there's only so many people that are entering that service every year, and the need seems to outweigh the graduates. So, the fact that we may be able to eventually partner and get a training program together where we can be basically growing that talent in our community in partnership with NTC. I hope that is still in the works, or that partnership is still under development. But, a key part of that discussion was that we really are a great department, but then continue to compete with every other community for talent. So.
Yeah, that's very much so still in the works, and I meet regularly with the president and the vice president of NTC. And one of the biggest catapults for this will be, and I'm proud to say we're still in the running for the Senator Baldwin's congressional spending. So if we get that money, this will make so many of these hurdles so much easier to work with NTC and to get more people opportunities to become firefighters if they don't have those opportunities right now because of challenges that they have in life and the lack of funding to put themselves through school and those sort of things. So
Sure.
yeah.
It's huge. So excited about that collaboration. The only thing that I would add as an aside, as we're talking about the fire department, is October 30th is the date that we have chosen for the council to share dinner with the fire department. And so Chief Kopp is working on our itinerary for that. The crew is going to cook dinner for us. The entire council and the mayor, I believe, have responded that we are all available for that night. It's a Wednesday night, so we'll gather together and share dinner with them and then tour our fire stations so we can have a different understanding of one another. I think we haven't done that in about 5 years, but it was super helpful when we did it. So we'll have that coming on the 30th. So thank you for being willing to host us that night. So
You'll all get your formal invites tomorrow with the
nice.
agenda on it.
Love it. So that'll be going out. Go ahead.
I have a question. I noticed in your report that that the equipment is aging. Some of the equipment is aging and repairs are getting costly. Is there any plans in the future to replace that?
So you'll see in the
upgrade them or?
Yeah, and you'll see in the deputy chief's part of it there, a lot of our equipment is fairly new, newer than I've been used to in my career over the last 20 years in Wausau. But we do have one large piece of equipment being the 100-foot ladder truck that is now going to be 13 years old. It takes, by the time you spec it and order it, it takes 2 to 3 years to deliver. We talked about a lifespan of that truck being 15 years, and we need to start doing something with it. So we are starting to push forward with Solomon from DPW and Finance to give us the go-ahead to start speccing this truck, put a committee together, and hopefully get something ordered and on the way, because it is the single most expensive piece of equipment in our fleet.
Yep. When we got that truck, we were fortunate enough to get an $800,000 grant to help pay the $1 million price tag.
And we're
now-
working on those too,
Yep, and now I understand that it's a $2 million price tag because time has passed.
minimum.
Minimum. So, I mean, there's hurdles to clear with that. Thankfully, we have been really lucky with the level of maintenance that we keep up within our motor pool, that we sometimes have been able to get more life from an apparatus than some other places might. But I think it's a good idea to have, the motor pool really does keep a good schedule as far as equipment replacement and cyclical maintenance. So helpful that we have them doing that, but that's going to be a big one when it comes. So hopefully there's another grant, but you never know.
For sure.
So-
And yeah, that truck is, I can't complain about anything that's done over its lifetime of 15 years. But it is showing some pretty concerning wear and tear on the frame. And to repair that is very costly. So that's something we've been working with Solomon and DPW on to make sure that we don't have any failures in that equipment and make sure it's still safe. But it is very concerning to see it happening, so.
Well, and, I think that we have learned that it helps to be ahead of some of that stuff, because in many cases, finance would tell us there's some resale value in that equipment if you don't let it get to end of life. And, if we don't let it stay in service as long as we let the yellow one or green one, whatever you want to call it, that was 30 years, so it was a little long, but
For sure.
good to go. So we'll place that report on file if no one else has any questions. And so then item 11 is the tavern activities report for the month of September. Anything that you have questions on there that you're seeing on the report? So typical month in the tavern report. So anything notable, Chief, that you wanted to chat with us about that you've seen?
No, it was a pretty slow month if you look at that. There were 50 demerit points assessed to one bar tavern that didn't have a licensed bartender upon officers checking. That's about it.
Sure. Okay. With that, the other item is item 12, which is our community outreach update. So you have Tracy's reports in the packet. We do not have her with us tonight, though. She's off today, I believe. So,
She wanted Jill to know she wasn't going to be here, and she's okay with that because she's on her honeymoon.
okay. Well, we're okay with that, too. So she, every month, gives us a fantastic report, and she has provided it again. We'll read it at our leisure. And given the fact that we've had an opportunity to hear from our downtown officers, we've really gotten a good volume of feedback anyway. So without any further ado, that's our last item. I'll entertain a motion to adjourn. Motion from Watson. Is there a second?
Second.
Second from Larson. Members in favor signify by saying aye.
Aye.
Aye. Opposed? No one's ever opposed. We'll stand adjourned. Thanks, everyone.